Should we get started? We get started. All right, welcome everyone in our packed house of a room. This session is called If I Knew Then What I Know Now, Mistakes and Lessons in Research.
Thank you so much.
And the idea behind this talk was, across the five of us, and really across all of us, we have things where we've gone through these studies and they just didn't work out the way we thought they would. We learned some lessons along the way, and I think we often kind of, learn that lesson ourselves. We internalize it, we apply it to our future projects, and hopefully find ways that we can share some of this so that, you all can learn from these as well, figure out ways that we can share the things that we don't often. We often celebrate our successes, but can we celebrate the things we learn? Can we celebrate our failures and use those as growth opportunities? And so with that, I want to introduce our amazing panel. And I'll start off. So I'm Mike Gottlieb. I'm the Ultrasound Division Director, Program Director for the Ultrasound Fellowship, and Associate Professor of Emergency Medicine at Rush University Medical Center in Chicago.
My name is Sam Lam.
Microphone.
I work at the Children's Hospital in Colorado and actually train in emergency medicine and pediatric emergency medicine. And I'm a professor of clinical pediatrics at the University of Colorado School of Medicine.
I am Yanina Purim-Shem-Tov, Professor of Emergency Medicine at Rush University Medical Center and Executive Vice Chair. And I have a master's in clinical research. And previously was Vice Chair of Research at Rush.
Good morning, excuse me. Good morning, everyone. I'm Jaime. I'm an Associate Program Director and Associate Professor at UCLA.
Good morning. I'm Peter Ho. I'm EM Critical Care at Brigham Women's Hospital.
All right, then relevant disclosures, primarily related to grant funding and other unrelated work, nothing that would directly conflict with this specific presentation, though. All right, so the intention of this really is to share stories, to talk through things that we've learned, and to share what we've learned from them. So I'm going to lead us off. And this feels particularly apropos as we're in an increasingly digital environment where we all work asynchronously to some degree. I walked around SAEM, there's people I met that I haven't seen in years, and some that I'd never met in person, and I had no idea what to expect because we always work asynchronously. And that's a common way to do projects. And it's efficient in several regards. I can work with people in other states, other countries, other areas that I would otherwise have no opportunity to connect with, to collaborate with, to work together. And that's great. We have to figure out how to work asynchronously. And there's all sorts of talks that talk through the different hacks and strategies for it. And there's all sorts of really, really cool programs that you can use. And one of the things I learned from some of my early collaborations is we often come with the best intentions. I have a strategy. I'm going to use a Slack, and Slack's going to hyperlink to my Google Doc, which is in my Google Drive, which I'm going to now use threaded chapters and be able to hyperlink throughout there. And I have this whole complicated system, and I'm going to use Zotero, and Zotero will be my reference manager because it integrates well. And for me, that all makes sense because I live in this sphere and I use it. And so I started doing this with one of my teams, and I started off with the Slack. No one was checking their Slack. I would Slack. I was like a monologue. I would just Slack and Slack and Slack, and no one would respond to it. I was like, okay, well, that's not working. So I started emailing. And then I was like, all right, well, go check the Google Drive. No one went. I put all my ads in the Google Doc, and most people either didn't look at it or they downloaded it, sent me a Word document. I was like, this is not working, right? And so it seemed good in theory. Look, we have all these different options of it, but I learned a few lessons along the way. First one is, think about your tech. Is tech the right, is the given degree of technology the right fit for the project? Do I actually need all the complexity? If it's a project that doesn't need Slack and I don't need to uptrain people to Slack, maybe that's not a really good use of our team's time. Maybe spending the first month of our project learning Slack is not a great idea for a project that's only going to take a couple months, and maybe we just can be okay with other platforms. Or maybe it's a longitudinal project and it's a series of projects we work together on, and we realize that email is incredibly efficient. Maybe Slack is the right option, in which case I need to build the foundation early. I need to train people on it. I can't expect everyone to know it at that level because it's learning a new system. Sometimes it's a matter of spending the time to walk through it. Sometimes it's being that tech support person. They'll say, all right, where are you having the challenge? Oh, it's because you get 7,000 notifications. Let me show you how to turn off your notifications and have normal time zones. And then you're like, okay, now I tolerate it. Now I'm not ignoring it because I realize that when I'm getting a message, it's important to me. So you have to build that foundation. You have to invest in that tech if you're going to use it, and be okay having a simpler model for your group if that allows you to be more productive, and then maybe start to layer it in piece by piece. So maybe it's not all the amazing features of Google Doc. Maybe it just starts with, let me show you how we can hyperlink. And then maybe next project together, let me show you how we can share Zotero or some type of reference software. And I found that that has worked much better than trying to foist my approach, my model, the things that work really well for me onto other people, and spending the whole time having us fighting tech as opposed to having it work for us.
I can get up here. It's a little bit easier for me to speak standing up. So I'm going to actually just back up a little bit before reviewing what I'm going to talk about. So I'm going to share my story of winding road of research discovery. That's how I'm going to title it. It's not very attractive, but here's the deal. I took a pretty winding road down before I actually discovered research. And if you're really interested in research, I hope that would actually point out there's a shorter pathway to get there. And you don't have to go down that winding road if research is what you're interested in. So basically, as I said before, I did emergency medicine residency, even though I'm working in pediatric setting right now. But during my residency, I sort of barely got by with my scholarly work requirement. It really, it wasn't that much, as you probably know, and I sort of barely got by. And I didn't have that full research experience until after my ultrasound fellowship. That was my second fellowship. And by full research experience, I mean coming up with a research idea, designing a project, seeing it through the IRB, implementing a study, collecting data, analyzing data, writing it up, submitting it for publication, and then seeing it being published. That's what I call by the full research experience. And it takes a lot, and that's probably why a lot of the time it actually happened after fellowship and not during residency. And right after I finished my ultrasound fellowship, I was sort of a dabbler in research. I sort of dipped my toes here and there in a research project, one or two at a time, and really wasn't quite sure if I was going to commit to it. And fortunately, I had a great fellowship director who I stayed with actually in Chicago at the time, and he connected me with all these people in ultrasound and research. So I got some early successes. I got some project done. I even got some external funding. I got small external grant. I got internal grant. So I was seeing a little bit of successes. And also I took the ASAP Embers course, which gave me a little bit of research foundation in doing what I needed to do. So at that point, I was reasonably happy. But I think as it moved on, I realized that I should probably do a little bit more. I got hooked on research, so to speak. And I decided to take the plunge and do a research fellowship. And that was 5 years after my ultrasound fellowship. And that was 2015. And I completed the research fellowship in 2017. And in 2018, this paper came out, of which Dr. Jaime Jordan is actually a co-author, came out in Annals of Emergency Medicine. It's a qualitative study asking those research pioneers in emergency medicine, what is your secret ingredient of success? What makes you so successful so far looking back? And here's what they say. This is a summary, I think. Research pioneers value advanced methodological training and mentoring. And that is the advice I never had. And that's really the take-home point for this slide. So when you do research, just like any other subspecialty emergency medicine, it takes a special skill set to do research. And this special skill set is just methodological training. You can do it a few ways. I mean, there's the ASAP Embers course, the Emergency Medicine Basic Research Skill course, and you have the SAEM ARM course, the Advanced Research Methodology Evaluation and Design course. Both of them are great. Actually, they are run by national known faculty. It's a year-long course. Right? Have you guys taken the ASAP course or the Embers course? I mean, the ARM course? No? So basically, it's a year, you took the Embers course? The ARMed? Yeah, so it's basically a year-long course, right? Both of them are year-long courses, and they're run by national faculty. They they have a combination of didactics, small groups, and you have a requirement to do a project. My understanding is the ASAP course is more geared towards people in the community who want to sort of like do small projects or maybe like be a good journal reviewer or maybe, just understand research. And the ARM is a little bit step up from that, although I took the Amber's course and not the ARM course, but that's sort of my understanding is ARM's a little bit more step up and kind of prepare you to do academic research and maybe get some small fund, grant funding. I think that's probably, is it fair? That the goal, yeah. So that's, and also your institution might actually have some courses to help you with that as well. Anyway, to go from a couple of days to like a whole semester. And that's going to give you some good foundation. But if you're really, really seriously into research and you want to do this for your career and you want to get that six figure, so the small grants, what I refer to small grants is basically a few $1,000s to like the low five-figure kind of ballpark. If you really want to get the EM Foundation or the SAEM Foundation grant, you need to do like probably a research fellowship, at least get a master level kind of class, because that's going to give you the skills. That's going to sort of take a deep dive into all those research methodology. It gives you the skills to look at like modeling, statistical modeling, and regression, and all those like advanced stats program that you heard about, and you actually know how to get into program and program it if you really need the skills. So that's going to give you that, and also street credit for really when you apply for grants. So the second part of it is just mentorship, right? So see, we have a pretty young crowd here. This is the original Karate Kid with the grasshopper, and yeah, right. You just like smile at Mr. Miyagi, like this is my generation, and for the millennials out there, you have the latest version, the updated version with Jackie Chan and Jaden Smith, mentor and mentee. But the reality is, in emergency medicine research, you don't just need one mentor. You need more than one mentor. I think you need a mentoring team. So there are different kinds of mentor, and I can just briefly go through, and Yanina is going to kind of carry this forward. So, for example, you need like a content mentor. You need somebody that's like a subject, an expert in your subject area of research. I mean, you are, but also you need probably a few more people that kind of help you like refine a study question as well. So you need a content mentor. You need a methodological mentor. You need somebody that really is very well versed in study methodology, so that when you go for your study design, they can look at the method and make sure that it's sound, it answers the question you want to answer. And then the third one, you need a career mentor, actually. I think a career mentor is really important. There's somebody that really knows you well and know what path you want to go down and kind of guide you towards that path. Because like all these other people are kind of helping you out, but the career mentor really knows you well, and that should be like the main mentor that you should be chatting with and checking in with, and make sure you're going down the right pathway. And finally, I think you need a grant mentor if you really, really want to get grant funding. It's that person that has a track record. It's that person who would know how to write a grant, teach you the grantsmanship skills and get you the grant you need to get. Because that's sort of, basically if you really, really go down research pathway and want to go for like NIH grant, foundation grant, like all these things, like more prestigious grants, and that's the pathway you should take. And I'm going to let Yanina do the next one.
Thank you so much. So I'm going to talk a little bit similar story to Sam's, but maybe a little different with some different lessons. My career in research started just like most of us in residency. And so when I came to academic institution, I thought, you know what, I'm going to carry it over. And my department was quite supportive. And in 2004, we had Masters in Clinical Research. It's an NIH-sponsored 2-year program at Rush, and with some other institutions as well. And it's a sponsorship for 5 years, and I entered in year 5. So 2004 was the year 5 of the program, and there was absolutely no concern that the program will continue on in 2006. And so my department protected my time. I entered the program, and 2005 did my first year, which is primarily all more of didactic classes on statistics and how to read journal papers, etc. And second year was supposed to be really focused on your grant writing skills. and how to acquire your mentors, your partners, your statisticians, etc. And so the program was going well, and guess what happened? NIH did not fund the second year. So the next cycle did not go over. And so the second year was really spent mostly about me writing my thesis on my own, sort of doing my own self-studies, and really not focused on how to prepare a clinician researcher for success in writing either K award or R1 or et cetera. So I come out of this program in 2006 with master's, and I am very well equipped, and I have my fresh degree, armed with it, and I am going to write a grant. So I partner with a very nice industrial engineer in our department who is a statistician, and he and I decided we're going to write an AHRQ grant, not NIH, but AHRQ, just kind of similar. And it's an omnibus grant. It was a multi-million-dollar, and we were studying at that time a novel idea of medical screening exams and nursing order sets from triage, how that impacts left without being seen and absconded rate. So we spent literally 9 months writing this omnibus grant, and we are so excited, and we submit the grant, all the deadlines met, all the support letters are in, etc., and we get scored at 300. Which is, as you all very well know, is not a fundable score at all. It basically means nobody actually read the grant, and we're going absolutely nowhere. So, thick skin, we take another minute to breathe and write another grant. Also spend about 8 months revising, revisiting, doing everything at bells and whistles. I mean, can't even imagine to tell you how much time we spend on this grant. We submit a second grant, and guess what? We get scored again, something over 200. So again, somebody maybe read this grant, but certainly is not going to get funded. So at this point, I'm quite discouraged. I mean, look, I have my master's. I think I know what I'm doing. I'm spending, these grants look beautiful to me. I read them, I mean, they make sense, and what is happening. So I decided to kind of sort of pivot, and at first I was thinking, is research really my thing to do? And I was questioning it at that time, and it is very defeating, of course, when you spend so much time and then you get really no funding. And so in the end, opportunity came up to partner with a very well-funded NIH researcher in our institution from a different department. And so they approached us, it's a behavioral sciences department, and said, we want to do a pilot study in your department. At that point, it wasn't funded yet, but we were going to look at women who present to emergency department in inner city with acute pain in certain areas. What are the factors that can break that cycle from them developing chronic pain syndromes, and how to intervene? Sounded extremely interesting. It certainly wasn't an area of my expertise or interest at that time, but I thought, what the heck? This person really knows what they're doing. They have lots of funding with NIH grants continuously for years as a behavioral sciences PhD researcher. And so I've done that. I partnered with that research, and we had a very successful pilot. We take the pilot data, we submit to NIH, and we get a $3 million grant in the next cycle, very well funded, and I'm co-PI. Now, I'm not a PI, but I'm a co-PI, so that already gives me a little bit of introduction into NIH funding and puts me up for a little bit more success. And it's a 5-year longitudinal funding, and actually has an extension with it as well as needed. And so instead of really not being able to sort of go on my own, I was successfully able to partner with other successful NIH-funded researchers and sort of continue my research career that way. And actually that turned into many other successful fundings with Department of Defense and just recently Department of Justice, where we are collaboratively submitting these grants instead of going out as an unknown researcher at that time. So if I have to give you a lesson, there we go. Don't feel defeated. first and foremost. I know it is a grueling process of getting everything done, timelines, etc. Just don't. Don't feel defeated. If it doesn't work the first time, the second time, keep on trying. And then, of course, the main point of this is establish relationship for those people who seem to have success, who have a track record of funding, and can sort of bring you along and ride their skirts, and that's okay too, until you get to the point where you are successful yourself, and that is probably the moral of the story. And I will pass it on to Jaime.
All right. So my mistake story actually happened fairly recently, and I just wanted to make that point that even when you've been doing this a while, we all still make mistakes. And so this is titled When Your Eyes Are Bigger Than Your Stomach. So this was something that I was working with one of my junior faculty colleagues, and we had this idea that we were really interested and passionate about, thought it would be contributory to our field. And we came up with a reasonable study design for this project, and we were ready to execute it. But we did recognize that we probably weren't super expert in the field and that there were other people that we could learn from. So we reached out to a couple of folks that were more expert than us in this area, and they made some suggestions in terms of how to make our project more impactful and more rigorous. And we're like, great, that sounds like a fantastic idea. Why don't we implement those? We'll tweak our project a little bit. We'll follow your advice. Makes it a little bit more complicated, but this is a good idea, and we're going to run with it. Those experts also, in turn, recommended other folks who were more expert than them. So we said, thank you very much. We'll go talk to those folks as well. And of course we did, and of course, not surprisingly, they had other ideas for how our project could be more impactful and more rigorous. And again, we were so excited with all of this project and how we were making this better and progressing that we said, sure, yes, we're gonna go ahead and we're gonna do that. Now again, all of these ideas and these tweaks that we ultimately end up making were indeed good ideas. They were gonna make our project better, but it also made the project a lot more logistically complicated. So we're motivated. My junior faculty is motivated. We're still going to proceed with this new model, recognizing that it's going to be a little bit more challenging, but we're ready to take on this challenge. Then, of course, the inevitable happens, and we all get busy. My junior faculty member takes on some additional administrative roles. I take on some additional responsibilities that distract me a little bit, and the project sort of stalls, right? In part because we were having trouble prioritizing it in terms of our other competing demands, and also in part because the additional logistical challenges just made it a little bit more challenging. Then we get the very disheartening news that another group is doing a very similar project, and it's about ready to publish. And so at this point, we're just devastated. We're like, we're going to get scooped. What were we doing? Why didn't we finish this? Why didn't we start with our very simple and more narrow-focused design and project to begin with? And we were really upset. But we sort of took a step back, regrouped, really thought critically about the project and what was going on. And we're like, well, this is probably still worth doing, and our project is probably still a little bit different, that we can continue to pursue it. But I think in the end what we really learned is that sometimes in all your research decisions, you really need to consider feasibility. And thinking about your resources, your time, especially when that time is unprotected, and how you're going to balance all of those different needs. So I think what we learned is really sometimes it's okay, particularly for junior faculty, and I think as a mentor, if I would have had more frank discussions with my junior faculty colleague in terms of what their bandwidth was, the additional workload that the changes we were making was going to require, and are we still ready to do this, it probably would have been a slightly different experience. I also think that this sort of story goes to just how important it is to really prioritize your research. Even though you might have limited time, even though you have other competing demands, making your research that you are really passionate about a priority and bring it to the forefront is going to be really important for enabling you to actually execute that project and be successful. So the story is not all down in the dumps. I will say, again, like I said, we sort of regrouped ourselves. We figured out that our project was different enough that it was still worth pursuing. And we did get to complete the manuscript and submit it, and we actually recently received a revise and reconsider decision. So all is not lost. But I think this was a lot of stress on my junior faculty member, on me. I think we learned a lot and we grew a lot, and there are definitely things that I hope you can take away from it as well.
So thank you. This actually leads to talk about feasibility. I'm going to describe lessons learned from a clinical trial that our group participated during the initial COVID stage. And this is as context, in the beginning of pandemic, there were a lot of thrombosis adverse events reported, and thromboembolic sort of prophylaxis in the acute care setting is fairly routine. And the thought of really providing potential prophylaxis in an outpatient setting, symptomatic COVID patients, how do we do that, right? Because remember, patients were symptomatic and they were told to stay home, right? So how do we do a clinical trial, randomized control, double-blinded, and really try to reach those patients? So this is where I think the lessons learned in a lot of the pandemic trials was we're basically building the plane as we're flying it. So first, of course, talking to the NIH, the groups from Data Quarantine Center, and also other major clinical coordinating center to help with the project had to think about the implementation part, recruitment, right? That's a major issue. So sure, they can come to ED, symptomatic, then we discharge them. So we can capture them during that time. So yes, we hire CROs trying to recruit that at that time, many study networks, trial networks, have already some kind of infrastructure to target those populations. But however, that's very traditionally time-consuming and also oftentimes hard to really capture the majority of patients who are staying at home, right? So there are also, other groups where they can have access to those patients who are COVID positive and then trying to target them at home. Other things in the trial is really look at, outcomes. But in terms of implementing trial is that also another thing is we also have a criteria of blood draw. How do you draw blood, when they're home as well? Definitely when they're in the ED, that's fine. But then sometimes in the ED, we may actually do a lot of the tent screening and they're fine to go home. There's no opportunity to obtain the blood draw as well. So those are two major factors that we need to overcome, as well as regulatory, how to get the drugs to them when they're home as well. So to be specific in terms of lesson learned is that devices of innovative kind of constructs came up where one thing of note is that there's actually CVS. Remember, CVS is actually doing the COVID testing. They actually have an associated laboratory. So they can identify those patients. The call center, they call the patients up using electronic consent processes to see if they're interested or not and get consent. And then, of course, we can refer them to off-site laboratory testing or actually laboratory phlebotomists, nurses who go to the patient's home to obtain the blood and then randomize them to the drug. The drug then, of course, is depot in one of the sites rather than the traditional where you go to ED, then you have to at the hospital pharmacy, research pharmacy, to provide the drug to go home with. So we were able to streamline the process using sort of a central depot using FedEx to deliver the home and tracking them, of course. So these are the innovations that we kind of learned over time. And of course, adjudication of the outcome as well. Definitely the call center, a lot of sort of weekly calls up to 6 weeks and all that. But it's definitely took a huge team and a lot of innovation to construct. Now, the lessons learned, though, is when our site got involved, interestingly, was on the later side where they want to think about other ways of recruiting more patients in the home. And one of the things that came up with the CVS sort of phlebotomy, the laboratory process, was we learned it was not as efficient as we thought. So that became a barrier. So we were a test pilot site where we were brought in, and then we used the CVS thing. Yeah, very similar in terms of getting the actual blood drawn and the timing of it, right? Because you have to meet some timeline to randomize as well. So we actually, again, think about other commercialized sort of outpatient entities. And Quest, right? Quest is available on different sites. However, having the patient go to the local site, there are models like that too within the trial. But then Quest also have a phlebotomy, home phlebotomy, to go to their home as well. And that was actually a little bit more efficient. So how we adapted over time during a trial, trying to recruit the patient. So this is the lessons learned in terms of clinical trial as we move on. Ultimately, the final outcome of the trial is that we were able to demonstrate that actually all the news, the reports of thrombosis and adverse effects of symptomatic COVID outpatients are actually very minimal. And minimal in the way that the placebo, also the therapeutic arm, there's no really difference. So in a way, as we do interim analysis, is that it was slated initially for 7,000 patients, but we were able to get up to 9%, 10% population, do analysis, show that, if you continue doing it, you're not going to see a difference among the different arms and all that. So that's the lessons learned in terms of one thing about clinical trial. And the next slide shows a little bit about, I think this is a new concept of how to decentralize research, right, compared to the traditional clinical research that we actually been doing. And a lot of it is a different site, as a site, hybrid, remote, directed patient in terms of the vertical axis, how the data are captured, and how the data are captured on the horizontal axis as well. So you can see the spectrum, how you want to design your trial, and how to, in a way, what's considered most efficient. Of course, it all depends on its specific hypothesis for the trial as well. Thank you.
All right, so we start off with 5, and we have more we can list. I mean, I have a whole CV of failures I'm happy to share any time. But we wanted to pause for a second and see, first, what questions do you have, what thoughts, or if you feel comfortable, what are some of the lessons you've learned that you'd want to share as well?
I guess one of my questions is, how do we be more public about some of these failures, right? I think because a lot of times people do struggle, and I think a lot of us have good mentors, and sometimes the mentors will share some of their things, right? But sometimes these are nuanced, right? Like you all gave great examples, but they might not be applicable to everyone. And so how do you get it out there so people don't feel, so alone and feel more open to seeking out, help when they go through this, and they don't want to just close up shop and say, okay, never mind, research isn't, my thing.
Yeah, I love that. How do you normalize being open with this stuff, right? How do you normalize kind of the vulnerability of saying, I failed at this. This was, this is rough. It's much easier to say, hey, let me show you how great the study worked out here, and let me tell you all the cool things I learned when it worked out successfully. But how do we share the times that it didn't? I think it's kind of been coming on us a couple different ways. And it's going to be interesting to hear what the group thinks as well. For mine, it's setting that stage early when when you have teams, creating a safe environment where you can share things you don't know, where you can share where saying, hey, I've been through this, here's what I learned, and here's why it didn't work out. And being kind of just normalizing that as an accepted form of communication. We redid the M&M structure, a decade or more ago from this kind of, almost like judgmental form of here's the morbidity and mortality that you caused to more modern versions of like, case-based educational, research or case-based educational conference and CPERC and other type of models that are like, okay, how can we identify systems issues? How can we learn from this? How can we evolve? And I think we need the same thing with our projects, saying like, these are, every single example I heard going through this, from more research, more training, to having something fall through and having to be able to bounce back up and being creative with your partnerships, to starting off with something small and get too big and then not either getting scooped or never getting it off the ground, to having to rapidly innovate in an ever-changing world. And COVID, I mean, we're living that. That resonated. It wasn't just with them. I mean, every single one of those resonated with me, and I suspect it probably resonates with you too. And I think once we start to see that as, it's not a me issue or a you issue, these are system level issues. How can we address these system level challenges together? Then it doesn't become owned on us. It becomes more open for discussion. So I think kind of normalizing it and then seeing it as not a fault of ours, but an expectation of a system that we can hopefully work together to plan for and adapt to.
I really like your question, because we were just discussing with Jaime. We're going to publish this. Because I know that negative result manuscripts do not get published. And that's what we see frequently, right? And so these kind of lessons learned, this is actually our second session. We did a similar session last year, which with a lot of lessons, and we have a whole slew of other lessons that we can share. But I think in the end, it's dissemination. And so dissemination, but also sort of making relationship and with other researchers and not necessarily just mentors, but just partnerships where you discuss those issues and also provide that feedback to your junior faculty as well. Mike and I work together, and both of us sort of go to each other. So how would you go about this? How do I go about that? Just because I have a little bit more of experience does not mean I know everything either. So I go to Mike with those questions. He comes to me, and we have a shared of ideas, etc. So I absolutely understand your question. I agree with your point, and I think dissemination of the information is probably the most important.
I was just going to add too, in terms of disseminating and really changing culture, maybe what we're hoping too is that you guys might take this sort of modeling of vulnerability that we're trying to do with sharing these stories, and then hopefully do the same at your institutions and pass that on, so that maybe we spread this whole like modeling of vulnerability to change culture.
Yeah, I totally agree. If you can go back to the slide, so we did publish it, right? So the lessons learned is an opportunity actually to give definitely in the way of its dissemination. But interesting to give you a little inside scoop on how we word the things that we learn have to be, of course, adjudicated by our sponsors. Because they were, during the time, it was really the wild, wild west. But, trying to focus on really lessons learned and carry forward, definitely publish it, disseminate it. You got a question?
I think some of that vulnerability, so I am 1 year out of residency in a research fellowship, and in residency you can in some ways compare yourself to your peers. And when you're the only research fellow in a department of very, very successful faculty members, it was really eye-opening for me coming here and talking to people from other institutions and realizing, oh, I'm not a complete and utter failure, that I've been in class full-time this year and I'm working clinically, and and I've got some papers out there and I have a negative trial that I'm trying to get on the third round. And so I think that's some of the problem too, is that we're a little bit more isolated than we were in residency when you're trying to do it, and it's really easy to get discouraged that way.
Oh, absolutely, absolutely. And I have maybe 2 comments on that. And I definitely empathize. That makes it 3 comments then. But I think the first one is that we often don't have the N, right? Speaking from a research mindset, if you send a survey across a listserv, I don't know how many people are seeing that. Did I get 5 survey responses out of 7 and I have a great response rate, or 5 out of 5,000 I have a horrible response rate? Well, if someone has 3 RO1s, how many N's? Are they 3 for 3 or are they 3 for 300? I don't know. We only publish and demonstrate the successes, and we have no concept of the number of failures that happen along the way. but I'm willing to bet it's much closer to 3 out of 300 than it is 100% rate. But we only see that back end, right? And I think that's one thing we should just be conscious of is when we're looking at that. I think the other that I've been increasingly myself trying to work on is not comparing against anyone except myself, where I want to be. And that's a really hard thing to do, right? Because we look around us and we try to create our metrics around the comparators because we say, I want to be that level, I want to do this thing. But if we look at this as, how can I learn from you, as opposed to how do I try to achieve some numerical CV line construct that has no more value than me typing on a keyboard, well, then it's just about where I want to be. What do I want to learn? Less so of what do I achieve. And I say this as someone who also goes after grant funding and appreciates the importance and the critical nature of that funding, but also what did I learn along the way and all the times that I failed with my grants? What did I learn and evolve from that? What will make me be better is a really, really important goal. Even if it ends up not being funded, I learn a lot from that.
Yeah, I can say something. Actually, just a couple of things. I actually just got recently promoted professor. I'm not that far along in that pathway. And just a couple of comments. One is that mentorship, that's why mentorship is important, right? You need someone that is invested in your growth and kind of point out the way to you so that you don't make these mistakes. I mean, they've made some of the mistakes and they sort of see the path ahead of you. And that's why it's so important. And I'm still like at this point, having mentors, I was just reflecting, I just chatted with my fellowship, my research fellowship director, just from like a few years ago, and he still give me advice. And I just started a new job at Children's Hospital, and I sent my email to my section chief. I'm like, I need a coach, I need a mentor. I still need to grow, and it is so important to have somebody to sort of help you out and kind of figure out the pathway with you. Even though you're fairly senior in your career, you still make mistakes, but there are definitely people ahead of you and more accomplished than you, and you should not be afraid to go and seek help. And my second comment is sometimes it's, that's what he said to me actually just right before I came here. Sometimes it's not about your destination, sometimes about your journey. If you fail, it doesn't mean that you didn't accomplish anything. I mean, you still traveled that distance, and there might have been something valuable out of that. And that's what he told me, like, just do what you're interested in doing. And sometimes it's just a journey and not your destination that's important. I mean, I know this is kind of how you're starting out and you want to get your career going, but kind of just looking back, it's true. Any other burning questions from you guys?
So I wanted to just one comment. Sometimes it's difficult to find those mentorship in your own department. And I saw that in my career. There was no researchers in our department, and there was nobody who could point out, do this or do that. The PhD person that I partnered with was very skilled, but certainly had no experience either. But other departments may have, and usually it's the internal medicine department or orthopedic departments, they typically have huge research engines and infrastructure, and actually seeking mentorship out in those departments is probably the best idea for a young fellow. The other ways is some institution, and that information may not be disseminated across the institution, but lots of academic institutions actually have formal research mentorship programs. And they start you from the beginning to the end. And so as part of the fellowship, you can probably enter into that, and it's free, and there's a lot of lessons you learned, and they will sort of foster and mature you through the process and get you to the point where you are successful without you being worried that, I have a negative study and I don't know where to publish it, and I've been rejected from 15 journals. Actually, one of the lessons was on that we're not going to get to, is where do you submit and will it fit that particular journal? There's specific engines that you can input your abstract and it will tell you this is the journal you should be submitting to. So maybe you can put that slide on.
Sure.
There's a QR code. So Severe has that. and also Jane, right? So in those, you can put your abstract, and there is a way to actually take a look and see where your particular topic would fit the best, because frequently you may think it would fit that and you want to reach that audience, but that journal might not accept your publication just because it doesn't fit their profile.
And so I think with our last maybe few minutes, we'll have each of the amazing panelists maybe share one other word of wisdom, thinking back on your careers, of something that you learned and would wish that you told your younger self, and can share with us all, myself included, to learn from that.
So I think one of the example which I invited in our national grant rounds is that if you want to be a researcher, you really need to plan ahead and think about your team, building your team. So going back to your isolation is isolate is a verb. So you isolate yourself, right? So then we have a choice of not to isolate ourselves and reach out to others. And researchers, I would say in general, are very, very collaborative to really share the resources as well.
I think that's a really excellent, Pearl. The other thing that I think, kind of going back to my lessons learned, I think one of the things you really have to do is prioritize your time for your research. Nothing is going to get done if it's not, kind of front and center of everything that you do. And it's hard, I know, with all of the competing demands. And if you're not funded, or you're trying to get that grant and you haven't had that protected time yet, it's even more challenging. But again, in order to be successful, it needs to be a priority. And the other thing I would say is just keeping organized and having projects that are at multiple phases to really streamline your productivity.
Well, I'm going to stay on the theme of mentorship and collaboration in research. I think in order for you to be successful, establishing those relationships is extremely important. And that's what kind of carry you over, whether you do it within your institution, outside of the institution, cross-country. There's lots of networks that are available, and just joining some of the interest groups would be probably very useful. SAEM, which is a clinical trial network across all emergency departments around the country, has a lot of working groups, and there may be an interest that you have that you just enter the working. Your institution doesn't even have to participate in that clinical network, but just participating in that working group can actually give you a lot of support that you need to be successful going forward.
So talking about network research is kind of just right along my, yeah. No, that's great. I just gonna follow it up. My myth, actually, that my second talk is the myth of getting network research and needing funding. You don't always need funding to do network research, actually. I'm part of this network called the P2 Network, Pediatric Emergency Medicine Point of Care Ultrasound Network. And we've done quite a number of projects with minimal, almost no external funding or small external funding, like a few $1,000s. And we publish papers, and this is probably not all for my profession dossier, but it's a very significant part of my dossier. It's just having worked with this network, published clinical trials in journals, and having this international, actually, kind of recognition, because we are all from different countries of the world, and we were young and we were out there, it was from 2014, and we were young and we were just go-getters. We want to make a mark for ourselves, and that is probably a number one thing. We didn't get much funding, but we were all eager to really prove that the pen pokers want to do, it's worthy of something, and yeah, we did a lot of trials without funding, and we were able to publish it.
So if I can summarize some of the key themes I've noticed so far, it's first of all, research is team sport. Seek out mentorship. Understand, we have local mentors to some degree, bigger, smaller networks, depending on where we're at. But that's one avenue of mentorship, and we should be seeking out external to get external lenses on things to broaden our networks. Our networks is what allows us to do bigger studies It's what allows us to think outside the box of what we know at our institution, to question what we know, and to see there's multiple ways to get to places, to innovate, to adapt, to understand the things that we think, are only unilateral. This is the only way I can do it. There's often a lot of really creative ways of thinking outside the box, including running a giant study out of CVS. And you can do these kind of really creative models, but those often come back to, again, we have to expand our networks. And we here at SAEM, this is the perfect place to take advantage of this. And so start seeking out those kind of external mentors, expanding our networks. And with that, thank you all for joining us for today.